Hi, I'm Katie Ayers with the Medicine Hat SPCA, and we're here doing a segment of critter care. And today we're going to be talking about walking our dogs in colder weather, because it's a question that we get a lot. You know, how cold is too cold? Should I put boots on my dog? Should they wear a coat? All that type of thing. Puppy wants to chew my mic right now. So I have one of our puppies that we have here at the shelter just as a bit of a demo. And certainly with this age of a pup, they're more likely to get cold faster. They just don't have as much body fat yet, and not as much, immunity kind of to the temperature that our dogs that have been through winters will have had already. Anyone who has a small breed dog, it's very similar to that they don't have an undercoat. So for example, Shih Tzus or Chihuahuas, they don't have that second layer of fur that some of the larger breeds will have, like German Shepherds or Huskies, where they have a much thicker coat. So dogs with an undercoat can withstand usually colder temperatures than dogs without an undercoat with the shorter fur. So those guys, I have, for example, myself, I have a Chihuahua and a Yorkie mix at home. Both of them to go for a walk in anything probably, I would say about below 0 - 5, they'll need a coat, something that will help them stay a bit warmer, a bit longer, especially if they're the type of dog that likes or needs to go for a decent length of a walk every day. You can find dog coats just about at any pet store, and we have some here at the SPCA, of course, that we do sell as well. So there's quite a variety. I won't go through all the different types, but this is just one example. This one has, of course, the reflection as well, which is nice for evening walks because it gets dark earlier now, and it's fleece on the inside. So with this type of a coat, it's pretty simple. Sometimes you need two people. We'll see how Puppy does. And this might be a bit big for her. She'll grow into it. And literally, you're just kind of popping the coat around. This one is Velcro, so it's pretty easy. And you want to make sure as much as possible that it goes to, about a couple inches from their bottom there. This has a little collar, it can go back. So that'll just keep her warmer for a little bit longer. She's tolerating that very well. And there's, again, such a variety. You can get ones that have legs that go all the way down, and there's ones that have little hoods that can go up. So you really have to gauge your breed of dog, their temperament, and how much they can withstand different temperatures. And how do you know that? Well, if they're outside going even just for a potty break, and you notice after about 5 minutes in, say, -5, -10 temperature, they're starting to shiver or they're starting to lift their paws, that's a sign that, of course, it's getting too cold for them. They need to come back inside, and that if you're going to be taking them for a walk, they're going to need something to keep them a bit warmer. Keep in mind, of course, that they are exercising, so they will have an increase in body temperature, so naturally they'll be a bit warmer that way. So you just have to pay attention to some of the signals with your own pets and make sure that they're not showing those signs of being too cold. For some animals, again, the smaller breeds especially, I know with my Chihuahua, I have to use booties if I'm going to take her for a walk in anything, again, colder than about -5 or so in her case. There's a ton of different types. The ones that I find work best, and most of them have some type of rubber on the bottom for grip as well. The ones that I find work best are a little bit longer in length. This is just an example of one. So a little bit longer. I think maybe this will fit you, Puppy. Let's see. It's a little small maybe, but for demo purposes. So you want it to come up ideally over the joint, and that's so that it stays on better. These ones will wrap around, which is even better, and has Velcro, and it also has a reflection strip. So these are actually a pretty good option, I would say. And right now they fit her. She'll of course grow, and it has a bit of the grip on the bottom, and it's fleece on the inside. So the important thing with the booties is that it goes up over the joint if you want them to stay on for longer. And ideally, you shouldn't be able to, like when you're tugging at it, you don't want to be able to pull it right off. And you'll have to see, sometimes you have to work dogs up to be able to wear the booties. Some of them will walk kind of funny at first, and it takes them some time to get used to it. And most of the time, they just adjust as they've worn them a couple of times on different walks. So Alternatively, if you have a dog that absolutely will not tolerate the booties, but you're finding that they're getting a bit too cold on your walks, there are different waxes that you can put on their paw pads to help protect them from especially things like salt that might be outside that they'll step on, and if their paws are cracked at all from just the colder weather, if they step in the salt, of course that would be a bit painful. So you could put some of those wax products on underneath, and any of the pet stores in our city will have those available, and you could chat with the staff about those. So those are just some tips for choosing coats and boots. And again, pay attention to your dog and their specific needs and their signs. Like right now, Puppy's getting a little chilly, Puppy's shivering, so Puppy could probably use a coat right now. And if she were to go for a walk, I'd put one on her in this weather as well. So welcome back to Critter Care. We're going to talk a little bit about the holiday season and some of the safety hazards that you want to consider if you own cats, especially in this case. So anyone who is a cat owner and lover and who puts up Christmas trees will often find that they have to use caution with their placement of the tree, and I know I've seen a lot of trees where people have had to put gates around them and things to prevent cats from jumping on the tree. So you have to get to know your cat and see if that's going to be a hazard for them. If so, I would advise putting the tree in a place that the cat isn't maybe allowed to be, whether it's a basement or a bedroom or something like that. If they're the type that is going to try and climb the tree and jump on it, whether it's a real tree or a fake tree, it can knock over, of course, and many people have had that happen to them. First of all, it causes a big mess, but it also can be a safety hazard to your cat. Your cat could get injured, of course. The other thing that I want to mention, there's a couple of things. Poinsettias are really common around this time of year, and poinsettias are poisonous to cats. It is a mild poison, technically speaking. If they were to eat the leaves, they would probably have diarrhea and perhaps start vomiting. But in larger quantities, depending on your cat, in larger quantities it can be quite toxic and can be very harmful for their organs. So again, if you do have a poinsettia in your home, make sure that it's in a location that's away from where the cat can access it. One of the most popular things around the holiday season that we see, again, especially with cats, and this one will happen with dogs too, is them eating something that has tinsel in it. It's a shiny object. It's fun for cats to play with. They usually like the shine of it, but also just the strands. Same with dogs. Dogs can really like tinsel or garlands. What you'll notice, if they're the type that will consume it, you might start seeing something shiny come out of their bottom. So what the veterinarians generally recommend is not to pull on it. I know I've seen this happen many times, where someone will see a piece of tinsel coming out as maybe the animal is having a bowel movement, and they'll try and pull on it. The problem is that the tinsel can actually be wrapped around their intestines, so if you pull on it, you could be doing a lot of damage. So what they recommend is you actually cut it off at that point. They will eliminate it as they continue going, and you can just cut it off, trim it wherever it stops, and don't yank on it. Ideally, they won't consume it, but we all know that sometimes pets will get into those types of things. Same with any types of toys. This is probably, Christmas decorations. This one is just a regular Christmas ball, but there's a lot of stuffed types of Christmas decorations on trees, especially for dogs, but some cats as well. They'll consider them basically the same thing as their toys. So you need to be really cautious with that. A lot of Christmas ornaments, they're not designed, of course, to be used as toys. So they'll have, for example, some of them might have like hard plastic eyes, which the animals can choke on or which can cause an obstruction. They might have glue or things like that in them, which our pets' toys don't normally have in them, so it could be something toxic as well. So try and make sure that the pets don't have access to take the ornaments off the tree, which I know is a bit challenging, but supervision is key with that, and or give them some special toy at Christmas time that becomes their Christmas toy. So I know for one of my dogs, I give her a Santa toy, and that's her toy, and I encourage her to chew that if she's going for one of the ornaments on the Christmas tree. So it's kind of another thing that you can do, another way around it. So those are just some tips with Christmas decorating and holiday decorating that you want to keep in mind for the safety of both cats and your dogs. So you may have heard that recently at the Medicine Hat SPCA we implemented what you can refer to as a no-kill policy. So basically what that means is that we've made the commitment to not euthanize any animals that are in our care for reasons due to space. So that's kind of a traditional shelter model, is that, you know, we're open admission, so we'll accept any animal that comes into our door, which is still the case. However, we have implemented a number of initiatives to help us be able to achieve this no-kill policy. If the animal comes in and for humane reasons does need to be euthanized, and that's usually a pretty serious medical condition or a pretty serious behavioral issue where they're considered a danger to the public, then of course we will administer a humane euthanasia. So that's with a veterinarian and in consultation with a behaviorist if necessary. But we will not be putting any animals down just for the fact that perhaps we're out of space to actually hold the animals. So what we've implemented to allow us to be able to formally implement this policy are a few different initiatives. So one is our foster program. So we do have a number of foster homes, especially during kitten season now, that will be able to take kittens into their home so that they have the litter of kittens in their home as opposed to them being here at the shelter. And that opens up actually a fair amount of space. The other initiative that we have is a rescue transfer program. So if we are really full, and this happened back in October, that we contact other rescue groups and say, hey, do you have any space available? Can we transfer some cats over to you? It's often cats in our case. And in October, for example, we were able to send over about 20 cats to a group in Calgary. The third thing that we do is, like we had in November, we had a cat adoption event because we were kind of overflowing with cats and we were out of space in our cages in our holding area. So you can see the boards behind me. This is all of the cats that have been adopted in November, and I just counted them and there was 83. And normally we only adopt out between 25 and 30 cats a month. So that cat adoption event was a huge success. We definitely had a huge amount of support from the media in helping to promote that event, and social media as well, and we had a lot of people come in and try and help out. So those are just some of the initiatives that we've put into place so that we're able to now adopt this no-kill policy and make that commitment to the community that we will no longer be euthanizing animals ever due to space reasons. Welcome back to Critter Care. I am here with Dr. Storch at the Cypress View Veterinary Clinic, and we have Casey with us, and she is in the water treadmill, which is an aquatherapy system that they do have at the rehab center here. So Dr. Storch, can you tell us a little bit about what Casey's doing right now?
Yeah, so Casey is at a little bit of a higher speed because she's got some longer legs, and she's just walking. So it's a really great exercise for them. They have resistance, but they also have buoyancy behind them. So they have that support. It all depends on how high we have the water and how low we have the water for how much resistance. So it's really good for exercise. It's really good for getting those legs and those joints moving, especially in our senior pets, but also in those pets that have had surgery, especially orthopedic surgeries. We have had some cases too of dogs that were hit by cars and were paralyzed that we were able to use the water to help support their weight to get ambulation back. So it's a really good option, especially for those senior pets that have difficulty walking, are having difficulty with stairs. We can strengthen their muscles. Yeah. So it's kind of like when you go for aqua sizes, as a person, it's the same thing. We just don't get them to do special tricks in here.
Of course, and it's easier on their joints, obviously, as well.
Absolutely easier on their joints. We also have jets in here, so we can increase the resistance. We're not going to do that because it gets a little louder. But Casey's doing a really good job. So we're actually going to switch it up for Casey as well. We're going to put on some water wings just so that you guys can see the difference when you have extra buoyancy.
So Mel is the vet tech here, and she works primarily in the rehab clinic as well?
Yes.
And she's just putting the water wings on Casey, which are basically, they look like little floaties. So what is the purpose of the water wings?
So with the water wings, they have to actually force their leg down.
Oh, yeah.
And so you can see it kind of leads to a slightly different type of walk. And so it's going to kind of force her leg up, and then she has to force it down. So it's actually more of a workout for them. Come on, Casey. You're doing great.
Yeah.
Casey's pretty experienced in the underwater treadmill.
And it does take a little bit of time for most dogs to get used to it. And there's this glass window over here that, you know, the owners can be on the other side trying to help encourage. And of course, you're encouraging with treats.
Yeah.
And you'll start it lower for smaller dogs.
Yeah. And then, of course, we want it, when they're first getting used to it, we want it a little higher so that they have that support. And then as they get stronger, we can increase the resistance. So.
And she's moving her legs one at a time, so you can really see how this would be good for strengthening, especially I'm imagining dogs that maybe have some hip issues, something like that. Come on, you're doing so good. Well, thank you very much. This is a really great tool that we have available in our city here.
Absolutely.
Welcome back to Critter Care. We're here with Dr. Storch at the Cypress View Veterinary Clinic. And Dr. Storch is going to give us a little bit more information on pet wheelchairs and why we might use one of these with our pet.
Yeah, so pets encounter the same things that we encounter as people, and they can become paraplegic or paralyzed in their back end. And it doesn't mean that that's the end for your pet, because sometimes these symptoms are temporary, but also sometimes they are lifelong, especially if it was a really big accident that has occurred. So we do provide options for wheelchairs for pets.
Okay.
So it doesn't mean we have to proceed to saying goodbye to them. Right. We can try something like this. So here at Cypress View Veterinary Clinic, we actually have wheelchairs that we can loan out, and they can be rented by owners to see if it's a right fit for them. We do have them come in for a fitting, and it just gives them a little bit more mobility. Now, pets do great in wheelchairs. They don't necessarily need them all the time, and especially because, you know, we have to have these supports here that can restrict some, like especially males and in their ability to urinate. Right. But it's a great option for them to kind of be more mobile, to feel free from their body.
Mm-hmm. I know I've certainly seen dogs specifically. I've never seen a cat in one, but you never know. I've seen dogs around at some dog parks sometimes in wheelchairs, and it's really cool how they can just motor in these once they get used to it. And you were saying before too that sometimes it is a temporary situation. Perhaps they have a slip disc or they're recovering from back surgery. So it could even just be that they need it temporarily. It might not be a permanent fixture as well.
Absolutely, because we understand that these systems can be expensive for people to purchase, especially if it's temporary. Right. Sometimes people want to have it for themselves, which is great.
We are really excited to be able to start our Extreme Shelter Makeover renovations in January. So officially January 8th is our start date for our phase 1, and it's taken a long time to get to this place that we're able to start. The first phase is actually going to involve renovating our holding area. So that's the area where the animals, when they first come into the shelter, they generally are housed back there. We're going to start with the cat side, and that means we're only going to have half as much space available in our holding area for animals. As a result, we are really going to be relying on our foster homes for support, and we're going to be trying to move as many dogs as possible into foster care until they have been seen by the veterinarian and behaviorally assessed to the point that they can go up into our adoptions area. So I really want to encourage people to go onto our website, and under the support tab you can click on foster, and that'll give you all sorts of information about fostering and what we provide as the Medicine Hat SPCA for anyone who does choose to foster with us. And you can fill out an application form there. We will then call you, set up a home visit, have a quick chat, and see what kind of animal you might be able to accept into your home. And this would be for short term. We're hoping the renovations will be done within about 6 weeks, but most of the animals would be able to come back within a 1 to 2 week period after they've been vetted. So please consider opening your home up and fostering an animal to help us out during those renovations as well. Welcome back to Critter Care. I am here with Dr. Storch at the Cypress View Veterinary Clinic, and we're talking about a topic that is kind of difficult to discuss, but we think it's really important for pet owners to have this information. Dr. Storch, can you tell us a little bit about what kind of advice you provide pet owners when they're wondering when is the right time to put their pet down?
That question's asked of us a lot. It is quite common in our industry because we do have this ability to help end suffering in our pets. So one of the biggest things we talk about is their quality of life. Now we have to remember about the cat and the dog, their quality of lives might be a little different. And a lot of the time I see where people tell me that their pet is still wagging their tail, all that kind of stuff. But we have to remember that if your dog is a dog, right, they're going to keep trying to please you. They're going to keep wagging their tail. So quality of life is, are they doing things that they like to do? Do they get to do those things? So for example, if you love to go for long walks, they don't really get to do that anymore. Laying around the house, don't really enjoy their treats anymore. And then of course, if there's any other type of problem that they have that can contribute, then we can guide on that avenue as well. But just in general, if they're just not doing the things they like to do anymore, if they're in any pain, which is a very hard thing to determine, if they are starting to get more aggressive is something we also look for, just because it tends to be pain related as well. So they can start nipping, being more grouchy, those types of things. If they're losing weight excessively, even if they're eating, it's not good for their system as well. So those are some of the things that we look for and whether or not it's time to put your pet down.
And I know it's, like you said, it is a very individual decision, and I think veterinarians you guys would go through this all the time with pet owners. It's probably a pretty common question you get, and not an uncommon procedure you have to perform as a veterinarian. So I think it's good for us to be able to rely on your expertise as well, to know what are the signs and symptoms, and if your pet has been seen by your veterinarian regularly, they also know what they're normally like, so they could see the difference. I know for one of my animals, taking it to their annual vet appointment, I hadn't realized that she had lost so much weight until my annual appointment came around and we were looking back at the chart, and she had actually lost a few kilograms, and she was a smaller breed dog, so that was a significant amount. And that was a bit of an indicator that, okay, maybe we should get some blood work done and see if there's anything going on with her. And so looking at the potential for is there some disease or illness that she's dealing with as she's aging, because there are a lot of common ones that, like issues with, whether it's thyroid isn't necessarily related to age, but for like kidney failure, for example. Anything else that you would say would be something that you see in most aging pets?
Actually, one of the most common things that pets get put down is for mobility issues. And we've talked a lot about mobility and how to get that back. But if you think about having a 100-pound dog, you're trying to get up and down the stairs, that's quite difficult as well. Incontinence issues, so the inability to hold their bowels and their bladder. And then, of course, the systemic issues, like you were talking about, kidney failure, liver failure. If they have the startings of this, we can treat that. But again, when they get later in the process, it's not so fun. Different types of cancers are quite common, and especially more recognized now as our pets are getting older with us. And so those things, so what we look for is their eating habits, weight loss, drinking and peeing a lot, all those types of things. But even as we've discussed previously, doing blood work beforehand as they're getting into their senior years is great,
Great. Can you walk us through the euthanasia process? I know if someone hasn't been through it yet with a pet, it can be a little nerve-wracking. Can you walk us through what would happen?
Absolutely. So in every clinic, it's a little different on how they have their procedure done. We try to make everything the same here at the clinic so everyone has the same type of experience. We want it to be as calm and gentle of a process as possible. And so usually we have them book in an appointment, and that allows us some time to spend with you and your pet, guiding you through the process. And it's something that we talk about and go through. We're not going to go ahead with anything until you're comfortable and ready. So the booking of the appointment is the first step. From there, then the veterinarian or technician, depending on how long you've been at the clinic or if you're newer to the clinic, will come and consult with you and talk about what you've been seeing and that kind of stuff and why we're at this stage in life. Then from there, once we do have to sign permission forms because it is a medical procedure, and we also need to follow the legislation from Alberta.
Right.
So we do ask some questions about biting and whatnot, but we do it as gently as possible. From there, we take the pet. So this is the hardest part, is taking the pet away to get an IV catheter placed. So we place that so that we can have nice access to the vein and that the procedure can go smoothly. So we place that catheter and then we give them a sedative in the muscle.
And that part is done in the presence of the owner, or
It's usually done after we put the catheter in and before we bring in the pet. In some instances, pets aren't mobile, so we actually come and do everything in the room with the owner. But sometimes even that process, we're very gentle handling, and we're just a gentle handling clinic anyways, so they can feel comfortable that we're not going to over restrain, we're not going to be rough, we're not going to have those things occur to their pets. So the sedative is, as I explained, to take that edge off. In some pets, they get very sleepy. In other pets, they can be a little bit more awake, but it doesn't really matter. And so it's up to the owner when they're comfortable at that point. So usually within 5 to 10 minutes, they're sleepy enough, and then we come in and guide through the rest of the process. So we give an injection that is an overdosage of an anesthetic agent. And so what it does is it puts your pet to a deep sleep, and then their heart stops. And so, as I said, it tends to be fairly peaceful. You know, we talk about some things that you might see after, but we do that with each individual person.
And of course, you know, I think most people that I've spoken to anyways have a very peaceful experience with that. And I know it's a lot of people feel very confident that they've made the right decision at that point. Seeing their animal in that peaceful state sometimes reminds you that maybe they were in more pain than you realized, or something like that too. And seeing them just completely relaxed, and you know, let people, because of course everyone grieves differently, and some people will want to do that in the room with the pet, other people will probably just want to leave and do that at home or whatnot. I'm imagining, you know, you have a comfort room here is what you call it, so it's a really warm, inviting space that they can spend with their pet and actually be with them for a little while afterwards, if that's what they're wanting to do. Yeah. And I know there's also some other options for like memorial kind of services that you offer and that most veterinarians offer. Do you want to talk us through those a little bit?
Yeah, for sure. So after the aftercare we take care of, unless there's specific requests that they want to take the pet home and do what they want at the end. But we offer a variety of things for pets in memorial to them.
I think it's part of the grieving process too, and it helps, you know, not everyone chooses to get a memorial or an urn, paw print, whatever it may be. There's lots of different ways that people will honor their pets. Sometimes they'll make a donation in their name, or they'll have some other type of just a photo memory or something like that in their home. So there's lots of options there too.
Yeah, for sure.
Well, thank you. It's really nice to have a good, you know, a better understanding of what the process is and just what the options are for people when their pets do get to that point. Thank you.
You're welcome.